Hi, everybody. My name is Michelle Campabasso, and I'm with Centric Home Health and Hospice. And I am in the DFW area, which is Frisco, Allen, Plano, and McKinney. I am the business development specialist, and I am here today with a great group of teammates of mine and my owners from Centric Home Health and Hospice. First and foremost, I'm thanking TJ for everything that he's done for this educational platform. I came up with this idea back when the pandemic started, and I wanted to thank HOMECARE2GO platform for bringing this live programming for awareness to our community and regarding our local healthcare businesses, resources, and education by experts. So he's done an amazing job to bring it where it is today. So I thank him and his technical team so much. You can see us live on Facebook, YouTube, Periscope, and HOMECARE2GO pages. You can follow us on social media and get notified when we go live. If you're interested in having a conversation, spotlight your company's role and offering, and you can click under the description below and sign up as a speaker or a sponsor. I love those out of the box companies, so please contact us on HOMECARE2GO. Today, we have lessons learned in this pandemic and how Centric Healthcare is prepared to service Texas and Oklahoma. And so today we have our wonderful guest. We've got David, Jon, and Miss Jeanna. And first and foremost, I would love to bring David on, and he would give a brief description on his role and everything about Centric that's so great.
Great, thanks, Michelle. My name is David Ochoa. I have been in some facet of post-acute healthcare for 36 years. Been in the industry for a long time. I am very excited about what we're doing today with this team and Centric Home Health and Hospice. We are in 2 states and growing steadily, and we provide both home health and hospice. But most importantly, it's a family, it's a team, and everybody on this call and all the rest of the team are really coming together as a group, and we're very excited about where we're going and what we're doing, and also today talking about palliative care. I think it's an important topic to discuss for those of you that want to understand better what exactly palliative care is.
Absolutely. And then I would like to bring Jon on so he can introduce himself as well.
David has more years on me. Been in healthcare for about half those. But to say that we're doing things differently during the COVID would be an understatement. We're doing things now that we probably never thought we would do, and we're not doing things that we thought we always would do. But it's an exciting time to be part of healthcare, and specifically Centric. I could go on and on about how much awesome we are, but it's an honor. The organization, it truly is people, and we've got fantastic people all working with the same philosophy, same vision, pulling on the rope the same direction, and it's an exciting time to be here. So thanks for having me.
And thank you for being on. And last but not least, we have Miss Jeanna.
Hey, I am Jeanna Weaver. I'm business development for Texas. I've been in healthcare about 10 years, did nonprofit before that. So I came to Centric. I've worked with Jon and David both for years and wanted to be part of a family setting again. And Centric was a perfect fit for that. So I've been in Texas about 2 years and loving it, and looking forward to growing Centric even more with Michelle and building a team down here that can, and a family that can grow our business even more. So yeah, looking forward to great things.
Yay, absolutely. Thank you, Jeanna. So my first question is actually for David and Jon, and we want to discuss about what is the vision and the mission care for Centric and the rest of the years to come.
So the vision and mission for Centric is simple. We do home health, we do hospice. We really want to focus on that. We do palliative care as well, and we want to stay focused on our core business, what we do, because that's what we do well. We have experts in both arenas. Texas is a very large state, And so there's a lot of opportunity for growth in the Texas markets. We're mainly in the north of Texas, and as we continue to grow, there are new opportunities because we believe that the care that we deliver and the people that provide that care hands-on really are the best around, and we want to be able to expand that market. So Texas there, and then Oklahoma as well, and there's great opportunities for growth in both states, being led by Jon. So Jon, why don't you fill in the blanks there?
There's opportunity, as David said, across Texas. Obviously, the DFW area is our most recent expansion area. Fantastic opportunity and great talented team down there that care a lot about people. So growth is happening. Some fantastic relationships that Michelle and Jeanna are developing and maintaining in that area. East Texas has always been a great place for Centric. Southern Oklahoma, Western Oklahoma, and our latest expansion is into the Oklahoma City, Shawnee metro area, which is a really great place and a lot of opportunity. At the end of the day, we serve communities. We serve the patients in those communities, and we go where the need is. What David has done is build a very strong back office and a good foundation for our company to be able to expand very easily and be very nimble as we do so, but do it in a methodical, correct way to do that. So I think Oklahoma, Texas, both great areas, and we're also looking at some other things that we'll talk about in future dates.
Hey, Jon, where are you guys hiring, and what kind of, are you needing medical? Are you needing non-medical? And can you tell them where they can actually send their resumes?
Absolutely. Obviously, we have our website that everyone can go to. Our latest expansion area is in the Shawnee area, but I would direct people really to our website because it's going to be updated daily, if not hourly, with not only blogs, information about the organization, but there is a career tab that will lead them directly out to ZipRecruiter or list any of our expansion markets along with current openings. But at the end of the day, we are always looking to be better. We always are interested in talking to talented people that are smarter than us, and people that make us a better organization. So if you're someone like that, bring your resume in, send us an email, but our webpage is obviously the place to go first.
That's exactly how I feel. I love being around people that are smarter than me. I definitely want to be the dumbest person in the room. So that's actually the best way to grow. And I love that mentality. So this could be for either you or David. Can you share more about your home health specialty programs?
Yeah, I'll jump out there. We have a lot of specialty programs, but the one that I'm most excited about, and I think that is probably the most applicable in today's time, is our palliative program, which really is a philosophy of care, not a specific service line. That can fit into home health, that can fit into hospice, that can fit into grandma's kitchen, having some nice chicken noodle soup that made you feel better. It really is looking at the person and optimizing their life experience. And that's what we do best. That's what our team does best. And just a great group of people that can deliver that care.
Absolutely, Jon. What we do with home health, we provide a care system, and we set goals and work with our patients and patients' families to make sure that we're looking for either curative or restorative results on the home health side, or looking for dignity and comfort on hospice. So either way we pivot, palliative care is really applicable to both sides, because the goal of palliative care is to provide and relieve suffering and to support the best quality of life in any scenario our patients find themselves in, regardless of the stage of the disease or the type of service that's needed.
Yes, absolutely. So could you tell me what kind of insurance pays for palliative care?
Well, palliative care can be paid for by both home health and by both Medicare and insurance. And palliative care is usually a bolt-on to other services that are being provided, but there are various palliative care programs that we're seeing expanded in hospitals today because palliative care is a real important part of overall patient care. So palliative care by itself can be covered in certain scenarios with physicians or in hospitals. But it's also an additional service that we provide either in home health or in hospice or somewhere in between as patients transition from one level of care to another.
Absolutely. That sounds great. And I know that Jeanna and I have been getting a lot of questions about palliative care in the secondary markets. If I could bring Jeanna on and just ask her, we actually just did a podcast with Acapella yesterday and talked about loneliness, and that was such an amazing podcast. So if you guys can look at it, just definitely go to Acapella. We had a great interview with Joe. We talked about loneliness, and not to get away from palliative care, but what are we finding in the secondary markets regarding hospice and home health and palliative care? Where do you see someone that would need that type of care, or how would they even, one would be, where would they get that kind of information, and who is the type of person who would need palliative care?
Well, palliative care, like Jon and David both said, is not just a hospice. It's really you're not looking at a case, you're looking at the person, you're looking at the family, you're helping them where they are at that moment. So the assisted livings, the independent livings, where we've really tried to get in there where the families are not able to because obviously of COVID, but it gives us an opportunity to care for the patient if they're on home health and they need that social worker. They need that help, just to get, past where they are right now. If they need the chaplain on home health, if they need that in hospice, of course, and those both are provided always, but that really is caring for that patient, not only in their medical, but their emotional. And so that's really where we're seeing people digressing, is that they need not only a little help with their medical, but they're needing that one-on-one with their social worker or with a volunteer. So we're really trying to focus on that and make sure our patients are cared for as a whole, not just their medical.
Absolutely. And we did talk with the social worker regarding the what was it about, loneliness and getting information. And what I want to get to is that we have our social workers that come from the beginning. So do you feel that that's one extra step that Centric does, is getting the social workers to come out in the beginning rather than at the end of service? So that's actually a specialty because we're actually getting the patient to know that we're there for them.
Yeah, exactly. Like Jon and David have said, we're a family and we treat every patient as a family member. They're not a number. So that when they come into our central intake, it's automatically a nurse in the central intake reviews the patient, and us, along with the family and the doctors, we create a team that gets the patient where they need to be. So if it is a hospice situation, but the family's not ready, let's bring you on home health. Let's, assess where we are. Let's get the family there emotionally. Let's not rush into anything. And that's where I feel like we do a great job. Hey, we're not emotionally ready for hospice. Dad still has longer. We feel like we want to fight. Okay, that's where you are. Let's get a social worker in there to help you assess where you guys need to be. But I think that's where we do an amazing job, is we not only take care of our patients, but we take care of family, and we, partner with home care companies. Hey, we can't do it for you. Let's let home care company get in here and help you, with the extra laundry, or, you live in Michigan, but mom lives in Texas. Let us help you get set up kind of a concierge service. Let's make sure your parent is getting every service they can. So our social workers are so great about helping with VA benefits and, DNRs and anything like that. So like I said, not only hospice patients are getting that quality of emotional, but so are our home health patients. And that's really where our palliative program excels.
And as we had talked about yesterday with Joe, she brought up a great topic really quick So what does someone do if they're not happy with their home health or their hospice? How do we as marketers let the patients know that they have a choice?
Yeah, absolutely. And that's what I say to anybody. Interview hospices, interview home health. Don't just pick whoever somebody told you. Ask around. Ask other family members, hey, who gave you quality care? But if you have a service and you are not happy with it, they are not providing, hospice is not providing that 24-hour call. They are not. You call your provider, your home health or hospice, and say, hey, this isn't working for me. I would like to go with another service. That's all they have to hear. It happens then and there, and they are discharged. But really focus on a company that's going to take care of not only you and your needs, but your family needs also. That they're allowed to call and ask the questions and stuff like that. And that's, like I said, that's what's great about our central intake. We have nurses on staff there that can be called, and then we have the 24-hour care that a patient can call 24 hours a day. So I think that's really what sets us apart from some other companies.
Jeanna, we had a great podcast yesterday with Acapella Home Care with Joe. So, I mean, there's a lot of references on there. So if you guys have a chance, just definitely check that out.
Yeah.
So, and thank you for being on that too. You were awesome.
Yeah.
So thank you. So my last question for the guys would be, so where do we see growth coming from in the time to come? Do you feel that Texas and Oklahoma are going to be those areas, or is it specific regions?
So certainly Texas and Oklahoma are our primary markets. We do look at expanding into other markets of Texas and Oklahoma for that matter. For us, we're a company of relationships. We're going to expand where the relationships drive us. So as we build relationships and we're best able to provide the care that is needed at a level that lives up to the quality and the standard that we have company-wide, then we move into other markets. But we do see expansion in other markets in Oklahoma. We have a lot of experience there, and as well in Texas, and with the strong teams that we have, we certainly look at continued growth in new markets from where we are today.
Yeah, I would agree with David. Texas is home to David and Oklahoma is home to me. And those are the communities that we're serving. But David made mention earlier that he's been in this business for over 36 years. In those 36 years, he's developed a lot of relationships across probably the entire lower 48. So when he talks about relationships driving businesses, there really are endless opportunities. But we're going to move in places that are really strategically advantageous to us. But it's a great time to be in the home care business, and we're looking forward to serving all of Oklahoma and all of Texas and points well beyond that.
Well, thank you guys so much. And I love that big word, advantageous. I like that. I'm going to use that now. See, when you hang around with smarter people, you get to learn bigger words. But thank you guys so much for being on today. This was a great show, and I hope that everyone gets to be able to understand what a great company this is. I am Michelle Campabasso. I am the business development specialist with Centric Home Health. We have all the contacts with all the guests, so if you need to get in contact with any of us, please let us know. I am at 469-688-4024, and I'm in the DFW area. We have very interesting guests lined up for not only next week, but for the rest of the month. So definitely sign up if you get a chance. Once again, I want to thank TJ and HOMECARE2GO platform for this opportunity and bringing awareness to our community regarding our local healthcare business and leadership that we all can trust. I mean, thank you so much for helping me grow this, TJ, because it was very important for me to make sure that the marketers were able to be a part of this, and as well as the community. And hey, make sure you check on HOMECARE2GO for the show. You can check on HOMECARE2GO's Facebook, YouTube, Periscope, and follow their pages on social media and get notified every Friday when we go live. Another thing that I wanted to say was that we are actually going to be partnering with Acapella Home Care and Teresa's house. And we are going to be doing grandparents, an event for grandparents for pajamas for seniors. That's going to be September 10th at Teresa's house. So if you would like to drop off some pajamas, we would love it. We have great sponsors. We are going to have a great successful event and hope that you guys can all drop off some pajamas. Nude pajamas would be great. If you have any questions or comments about that, please contact Jeanna or I, Acapella. We have tons of sponsors, but we would love to have you contact us and we can get them to know what's going on. We will be marketing that soon. You can also see recorded conversations of the show on I can't talk today. It's Friday, you guys. HOMECARE2GO's Facebook, YouTube, and Periscope pages. So don't forget, follow them on social media every time that we go live. You guys be safe and have a safe and happy Friday. Take care.